Well, I think once they get over that hurdle of making the right diagnosis in the patient who has COPD, there are a number of other challenges that they then face, and they're really the same challenges that they face in managing any patient with a chronic disease. So the changes in lifestyle that these patients have to make, stopping smoking, increasing their physical activity, dealing with new medicines, adhering to those changes, whether it be the lifestyle and behaviour changes, whether it be taking their medicines, taking them correctly. So, there's a number of things there that GPs have to be very mindful of. Well, they're certainly not diagnosed with an X-ray, okay? And they're certainly not diagnosed on symptoms alone. But if a clinician is suspicious that a patient does have COPD, so it might be somebody who presents with respiratory symptoms such as breathlessness or cough or sputum production, and they're over our magical age of 35 years of age, and especially if they are a current smoker or an ex-smoker, so that would raise the suspicion that this patient may have COPD. They would then need to confirm that diagnosis by undertaking spirometry. With the Lung Foundation, we do have guidelines that have been done in conjunction with the Thoracic Society of Australia and New Zealand, and it's quite clear in those guidelines about what best practice management is, but that goes across a number of strategies. For example, the one that has the best evidence for it is stopping smoking. Okay, that's quite understandable. And the other one is increasing physical activity, and in particular pulmonary rehabilitation. But of course there are some medicines as well that have some evidence around them in improving quality of life, improving breathlessness in this group of patients, decreasing exacerbations, and therefore decreasing hospital admissions. The COPDX plan is the management guidelines for patients with a diagnosis of COPD. So those management guidelines have been developed by the Lung Foundation in conjunction with the Thoracic Society of Australia and New Zealand. They are evidence-based guidelines. They are reviewed 4 times a year, and where the evidence is reviewed and those guidelines are updated. So COPDX is a mnemonic standing for C for confirming the diagnosis of COPD, but we also talk about case finding now as well. So O, optimising the function of these patients with COPD. P, preventing deterioration. D, developing a network to assist these patients manage their disease, and also assisting those patients self-manage their disease. And X explains the strategies around managing exacerbations. So we're very much looking forward to running our session at GPCE, and we're going to focus on a number of different areas from our guidelines. So we'll have a session on how to find patients with COPD, which patients are at risk of COPD, how to diagnose COPD. So we'll have a session on spirometry interpretation. We'll also have a session on the new medicines available for management of patients with COPD and the tsunami of medicines that have become available over the last 1 to 2 years, the different devices that are out there, and we'll have devices there and instruction on how to use those devices. So GPs can have a look at the whole suite of devices that are available, the whole suite of medicines that are available, and get their hands dirty by playing with those devices. We'll also have some sessions on the non-pharmacotherapy management of COPD, like the role of pulmonary rehab, and how to increase physical activity in these group of patients, how to implement care planning and self-management. And we'll also have a session on managing exacerbations. And to conclude, at the end of our active learning module at GPCE, we'll have an Ask the Expert session where we'll ask one of our specialist colleagues to come in and assist us, and any of the curly questions that GPs have, we'll handball them to them and see if they can answer.